Hi, how are you?
Good, how are you?
Excellent. Yeah, I'm very well, thank you. So, in your notes, you've written that you've got a right-sided neck pain as such. How long has this been going on for?
About 6 to 8 weeks.
6 to 8 weeks. It's a little bit chronic as such, yeah?
Yeah, I've tried a few different things, but nothing's quite worked.
What have you tried thus far?
I've tried some physio,
Mm-hmm.
went to the chiro, deep tissue massage,
Okay.
and everything helped a little bit, but it hasn't quite gotten me to where I needed.
Excellent, excellent. What we're going to do first, before anything else, I know that the chiro and the physio and everybody else should have done it already, but you just do some muscle testing. We're going to do a little bit of mobility aspects.
Okay.
At any time when we ask you to do these techniques, any pain radiating or moving, let me know as such.
Okay.
That way we'll stop and we may ask for x-rays or we may ask for something else a little bit more. So what I'm trying to rule out is some red flags. And red flags are really important because there might have been some sort of underlying issues that we need to address as well. Okay? So first of all, whilst looking at me, I'm going to need you to rotate your neck left and right for me. Rotate for me.
Well, this side's a bit easier.
Yeah.
It's the right side that gets me.
Yeah. So it's softer around there. Okay,
Yeah.
Excellent. Now with that said, is there any pain radiating down the arm at all?
No, not down the arm, more
Okay.
down the shoulder blade.
Okay, okay. How about nodding forwards?
Tightness and a little bit of pain.
Tightness. Is the tightness radiating sort of down the back or through the front?
Down the back.
Down the back as such, yeah. Have you had any past injuries as such, like falling off a bike or any other?
Years of sort of rugby and whatnot, but nothing acute, just more, I guess, wear and tear around
Wear
the
and
area.
tear?
Yeah.
Okay. Is it keeping you up at night time?
Yes.
It is. It wakes you up in the middle of the night as
Yes.
such. Okay. When that happens, is there anything that relieves it? Any pain medications like aspirin, Panadol, or anything heavier?
Pain medication worked in the beginning,
Yeah.
and then after a while, it's not as effective.
Okay. So I'm going to ask you first, is just to do a little bit of testing as such. I'm going to get you to push up on my hand, please. Push up. Yeah, and then push down. Okay. And push away. And in. Anything untowards?
Yeah, the away.
Away more so than anything else?
Yeah.
Is that in the neck area or in the shoulder area as
In the
such? In the neck, okay. At this time, I'm going to get you to just rotate. Yeah, bad.
That's not too bad.
Not too bad. So what we're trying to do is rule out the accessory muscles or the accessory aspects that could be contributing to these aspects, yeah? So same thing in there, pushing up, pushing down, pushing towards me, and then back in. Okay, any pain?
No.
Not much. Same thing, we're just going to do some rotation. Not too bad that way. And not too bad
No,
that
that's
way.
fine.
Okay. So, are you quite happy with me to touch your neck so I can, yeah?
Yeah.
No. So what we want to do now is just sort of going inside and feeling around for any abnormalities, any lumps and bumps. Yeah. No swelling of the neck area at all.
No.
Okay. No past history from any family members having similar conditions.
No, not that I'm aware of.
Okay. Doesn't seem too bad in there. The last thing I'm going to do is just put a little bit of pressure on your head. I don't want to squeeze it really hard, but what we're trying to do is to see if there's any compression as such there in that area, yeah? So you let me know. Any?
No.
No? Okay, it's a good thing, yeah?
Yeah.
Alright, so what I'm going to recommend is probably do a little bit of acupuncture today for you to loosen up these muscles and to loosen up your shoulder muscles.
Alright.
At that point, we actually might flip you around and do some what's called distal acupuncture. And distal acupuncture is using microsystems of the body to relate to the neck area. Okay, you're quite welcome at any time. If anything feels untoward or anything feels painful, let me know. It shouldn't be. If it is, let me know, and I'll readjust the needles if necessary. As such, yeah. We may even do a little bit of what's called gua sha or cupping. Have you heard of those sort of conditions?
I've heard of cupping.
Cupping, yeah, little suction cups or circle marks, yeah.
Yeah.
They're fantastic for this. Gua sha is a similar technique. It's a myofascial releasing, so we're going to actually myofascial, or release some of those muscles in the neck area with an implement that I use, and we'll see how we go. We'll take everything step by step. If anything feels uncomfortable, please let us know, and we'll go from there.
Sounds
So
good.
I'm going to step out for a little while. I'll close the door. I'll leave you some towels. At that time, take your shirt off and face down,
Okay.
and we'll work on your shoulders from that point.
Alright, thanks.
Thanks. So what I'm doing now is, first of all, working my way through to see in this position if there's any abnormalities. So some people have some spinal differentiation or differences. Not too bad. And we look at where the muscles connect, see if there's any sort of one side's larger than the other side. We can't see that. We may also feel for any knots. So this is your left side, but the right side was the worst one, yeah.
Mm-hmm.
We also may look at the scapula and see how that's positioned. Some people have what's called winging, or one shoulder more forward than the other. So we're trying to break that up a little bit to see if we can find exactly where is that tender?
Yeah.
Yeah, okay. So you can feel a little bit of gristling. So the fibers themselves are being bunched up in that area. So we're going to use a little bit of acupuncture through the neck, into the shoulder region, and maybe a little bit into the rhomboids. The rhomboids are those muscles that, you know, having your hands forwards. With all of us staying at home a little bit and using computers a little bit more, our rhomboids are getting a lot of work out at the moment, same as our traps as such.
Okay.
Do you do much heavy lifting or weights at all?
A little bit.
A little bit, yeah. So sometimes above head can cause a little bit of issues if your neck isn't in the right position as such. Yep.
Okay.
Now, once again, you let me know how you feel about these needles as such as we're going through. Most of the needles you may not feel at all. Some people may feel them more than others. You let me know and then we can change it. So what I'm going to do is find the location first. How was that?
Didn't even notice it.
Excellent. Well, a lot of people will feel that area. You may sometimes feel a little bit of jumping sensation, predominantly with the next point that we're going to use. Not this one, the next one. So these ones are not too bad. We use points for their function, but sometimes we can also use it for other aspects as well. So you predominantly came in for a musculoskeletal pain condition, but what we can do is, you know, have a larger picture of you. So we did before we did pulse acupuncture, or pulse diagnosis, should I say? The pulse diagnosis was there to see what kind of constitution you have. Now the point that I've used now is in the trapezius, and we hold on to this muscle because we want it to be a safe point in that area. Now you may feel a little bit of a jump occurring.
Okay, yeah.
Yep. So it jumps in response to that area. At the same time, I can actually feel the muscle relaxing underneath my hands.
Yeah.
I'm just going to give that a pinch. There it is. I can feel it relaxing, so there's no need to ask you. Are you comfortable?
Yeah, very.
Excellent. Are you warm enough?
Yes, thank you.
Excellent. It's very important whilst we're getting acupuncture is to feel very relaxed. What happens a lot is that your body will, you know, is sympathetic response. You've travelled to get here, you found parking, you've gone out hunting for that spot, you've run in to get here on time, and at that point your body's fairly wired up. So what we try and do with acupuncture is put your body back into a parasympathetic, to sort of a relaxing state. Many clients that come in to see acupuncturists, and not just me, but most acupuncturists, will find that they have a sense of well-being, a sense of peace, and a sense of relaxation whilst having the acupuncture, especially if we've hit the right sort of points. So what I've done now is put some points in there. I'm going to leave it for about 10 to 15 minutes. At that point, we'll come back and we're going to do a little bit of that gua sha that we spoke of.
Okay, great. Thank you.
So now we're going to be doing a little of the gua sha. So there was restricted motion to the right, as you can see through this area.
Yep.
Now gua sha is the other name for it is scraping. They also use coining or spooning, using a traditional Chinese spoon as such. And I use my tools because they're a little bit sort of lighter, they're a little bit smoother to the skin as such. And what we're going to do is work our way through the muscles as such,
Okay.
and trying to scrape them out as such. The beauty of gua sha is that it's not just a technique. it's also a diagnostics. So when we're actually scraping, we're going to see different colors. And these colors are indicative of what actually is occurring. So we can actually find which particular muscle was being affected. I use a little bit of lubricant. Are you allergic to anything that we know of?
No.
No? Okay, cool. This is just a little organic blend that I use. It's not thick and it's not thin as such yet. It's going to keep it forward as such. So all we do first of all is just what's called scanning. So we will scan the area. So, and what we're trying to look for is there's a little bit of red there. We're really looking for that purple, if anything, yeah?
Okay.
The purple is indicative of what we call stagnation. In Chinese medicine, there's a famous saying that where there is stagnation, there is pain, but where there is pain, there is stagnation. Indicative that any time that we're stagnant or we're not moving, pain will come from that. So that stagnation can be in the mind, in the muscle, in the bowels. If your bowels are all sluggish, you're going to get pain in your stomach. If you're stagnant in the muscles and it doesn't move, like a tendonitis, you're going to get pain. We're just working our way through. Is this tender in any which way?
It is a little bit tender on the right side, yeah.
On the right hand side? Okay. So but it's not unbearable.
No, not painful.
Excellent. Look, some people are, we do this and they're like, it's that sort of pleasure and pain aspect. So they feel a little bit of tension, but they also it's very relieving. As we can see here, there's a little bit of purple coming up. That's indicative that it was the rhomboids that we thought that was aspects. So it's all when your hands are up as such.
Okay.
So if you're either using a mouse or using a laptop inappropriately, they're the kind of aspects that we're looking for. So just to open up that rhomboid a little bit more, I'm going to get you to put your right hand on your shoulder, please, on your left shoulder. Excellent. So that opens up these areas for us as well, so we can get the upper rhomboids and the lower rhomboids as well. All right, so just slowly we're going to start rotating your neck for me.
Which way?
Yeah, left or right. Just rotating that way first, and then the other way. And I'm using a very light method, and we can see that this area is picking up the color straight away. Tilting a little bit, that's it. So this technique, has been used on kids. It's just a matter of how much pressure one applies. Like any technique, if it's used in the hands of someone that doesn't know what they're doing, it can be a little bit sort of untoward. So first of all, if the person is very deficient or hasn't got a lot of energy inside of them, or depleted, should we say, I wouldn't be doing this. It's someone that's young and vibrant. This works a lot better for them as well. So we're trying to take away that stagnancy away from the area. See how that's feeling?
Yeah.
All right. Get you back to the front, and I want you to rotate your neck for me again. So you're actually moving a lot better that way. And moving the other way a bit more stuck. So sometimes
I feel like I got a little more range there.
Yeah. So we can use the other side as well. Keeping in mind that when we finish this, I don't want you to go have any cold showers. I don't want you to expose your back any more than necessary.
Okay.
So we suggest people, you have your shower, dry yourself off, put a t-shirt on, covering up your back. You don't want to get any sort of exposure or your muscles cramping up again around that area.
Okay.
This color will probably stay for 1 or 2 days and start to dissipate after that. Once again, if you do it too much in the hands of someone inappropriate, this may be for longer as such. Alright, I'm going to get you to move again for me. Actually, I can actually feel a lot of these muscles being activated.
Yeah.
Get you to tilt forwards a little bit now. So we're just going to get there's a little tendon that runs through this area, and that sometimes keeps the neck tight. It's very gentle working on that area. Not doing any more than we should. So it's just a matter about breaking up some of those adhesions and the tightness that one has, and back up again. Especially if you're one to use a lot of telephones or smartphones at the moment, or keeping your hands in front of you as such. All right, what we'll do now is have you facing up. Okay, so we talked about distal acupuncture and acupuncture that's called that's corresponding to the neck area. All right, so the right hand side of your body, some would suggest that the left side is corresponding to that. So we use different points. One of the famous doctors, he's got his own system of acupuncture called tongue acupuncture that we work a lot with. So he decided that, you know, even from the second metatarsal, or metacarpal should I say, these areas representing your spinal area. So up high in these areas is relating to your neck. So what we do is find the tender spot. So that's like 1, 2, more in there. So we're going to use that as the active point for it, okay? But we've got many different other points as well. So you can just say that this whole area is representative of your head, this as your body. Yeah?
Okay.
So it's mirroring what's occurring in there. It's using it as a micro system. So these would be more into the occipitus area. So you got a little divot there. See the little divot there? That's indicative. And that's more at the front area. So we look for the tender spots in these areas to see if they're active or not. If active, we needle them. If not, then we don't. There is also small intestine channel that we can use. The horseshoe, which is a point that we use, a small intestine point, is very good for that. We've got another point, which is Laozen, which is another neck point. All these points are slight variations on the same theme, and some are better than others. So I would normally, and on the other side, normally go and see which one was more tender or more active for that matter. And we saw that that one was one of them. We may sort of give a little bit of a press in there. That's not too bad. And we can use all of them as well. We can do the same thing with the ankle points as well.
Okay.
We're going to be doing the hand points as such.
Okay.
Hand points can be a little bit stronger, which is what we're looking for. And what we're going to ask you to do is when we actually use the point, I'm going to actually ask you to move your neck at the same time.
Okay.
So it's a fairly strong point, yeah?
Mm.
Can you move your neck for me? Some people find a somewhat instant response to the same, to the use of the point, which is fantastic. It's feeling somewhat better.
Yeah, there's more range, less pain.
Excellent. More range, less pain is exactly what we're looking for. First comes the range of motion. But with that said, if you've got a hypermobile neck, you don't want to sort of twist your neck and then twist it beyond the point of normal. So getting some more motion is going to be important. It's important for better breathing as well, better driving, all those aspects. And once you start moving the neck, we're getting more flow to the area. We're going to get your neck circulating more blood to that area and helping all those, stuck tendons and ligaments and what have you. The other one that a lot of people don't cover is the sternocleidomastoid muscle. So that's the muscle that goes around this area. It's got a big involvement in all the movements of the neck. And what I tend to do is just go around and see if they're tender. And on occasions we find them super tender. Yeah. So we're not needling them today. So we've got a technique of just doing some releasing massage for that area.
Wow.
So from this point, and we're going to do a little bit of homework, I want you to go home in the afternoons, and when you get the hot water on your chest, is just to stretch your neck a little bit and to find these tender points yourself, yeah, and just give it a little bit of a massage, and at the same time rotating your neck.
Okay.
So it's not always about the front. Anything that if there's a back, there has to be a front. If there's a top, there has to be a bottom.
Okay.
Yeah, you've heard of the term yin yang.
Yeah.
Same thing. If there's male, there's female. The day, there's night. There's back, there's front. So we need to balance up. If a lot of times, like I said, we use the feet to treat the neck as well.
Okay.
It's about balancing.
That's very tender.
We're going to be using the low-level light laser, and the beauty of this is that, for one, there is no pain. Yeah. But why do we use this more than acupuncture? One is because we can use it more often. The other, it's great for inflammatory components. So your tendons and that are inflamed at the moment. So what we do is just stick the needle end. So that would be representing an actual needle going into the skin itself. Every single cord is a new needle that we can use. It uses light. We've got 2 different types of lasers here at this clinic. One is the red light, which we're using now, the 12-point laser, and the other is the infrared. The infrared we use a lot with children, and it's a little bit more mobile as such. We use this once or twice per week. The treatment is about 20 minutes in total. And what we want to do is just to get that inflammatory component, to subdue that for us. There shouldn't be any pain as such.
You can barely feel it.
It's not on yet. That's probably why you can't feel it. It's being stuck on at the moment as we can do that. So there will be a big red light as such when we start turning it on. You do have the glasses available to you. They're all facing down, so they're not going to be beaming into your eyes in any case. At that point, we want to turn it on. So there's a whole different programs that we can use, up to 300 different types of programs, settings. We'll let that turn on. There's no need to stay really still or anything like that or panic. The term laser has got different connotations for different people, but you'll see in a small while that having it on will be fine. So we're using now a Nausea C program. We're going to use 20 minutes and we're going to have 30 joules of energy throughout every needle tip. So we turn that on and then that starts beaming as such. Any sensations?
Oh, very, very light, yeah.
Some people may feel a sensation, but it is a light aspects, as in not light as in touch sensitive, light as in the lights that we're looking at. Yeah. So once we do that, we'll leave that beep. Every 30 seconds it'll beep, so we're looking at 20 minutes of it. So stay really calm and we'll go from there.